There is a misconception in our society that if a woman attains menarche, that is menstruation, at an early age, her menopause also will come earlier than other women. It is not true. At whatever age they develop the first menstruation, the menopause will come only when it has to come, approximately between 45 and 50 years of age, give or take 2-3 years this side or that side. So that doesn't make a difference. And they need not worry that once menopause comes, they'll be deprived of their sex life. No. Menopause is the end of reproductive life. It is not the end of a sexual life. What happens in menopause? The production and distribution of the female hormone estrogen is stopped when a woman attains menopause. Because of that, there is a turbulence in the hormone balance in the body for next 2 to 3 years. At that time, her mood will be affected. She may be irritable. She may be depressed. She may lose interest in sex temporarily. In about 2 to 3 years, once the body adjusts to the new hormone levels, she will regain back all these things. When the female hormone estrogen levels are reduced, the vagina will become dry because the vaginal health depends upon the female hormone. So her vaginal lubrication will reduce, so it becomes dry. So she cannot have pleasurable sexual intercourse because it's dry, it will be painful, irritable. Right? If a woman has not enjoyed sex before menopause for whatever reason, marriage was forced on her, she doesn't like her husband, they don't indulge in proper foreplay, she can't get turned on, husband has erectile dysfunction, husband ejaculates very quickly, premature ejaculation, so she is not enjoying sex. So she will use an excuse of menopause to avoid sex and show disinterest in sex. Because what she thinks is, anyway I am not going to get anything out of sexual intercourse, so why bother to have sex? However, if a woman has enjoyed her sexual life before attaining menopause, she will look forward to pleasurable sexual life after menopause also, after the 2-3 years of body getting used to low levels of estrogen. Absolutely, she will not think negatively about sex. She will look forward to sex and enjoy her sexual life. The problem may come because of a dry vagina. Because the dry vagina happens due to reduced levels of estrogen hormone, the woman can undergo estrogen replacement hormone therapy either through medication or through estrogen creams. If that is not indicated, not suitable, then the woman can use artificial water-based lubricants like KY jelly and lubric gel, etc. They should not use any vegetable oils because that will become a breeding ground for bacteria and other organisms. Right? That's how they can overcome that. So, menopause is not the end of sexual life. Menopause is the end of reproductive life. That means the woman cannot get children after she attains menopause. She cannot become pregnant. It is not end of her sexual life. So, if a woman attains menopause, she need not worry. If she needs be, she can consult a gynecologist and take appropriate advice and treatment.